So I would like to present to you the need factory, or the factory of necessities. It's a factory that has a twofold meaning. We want to find the true clinical needs in a hospital, and when we have a qualified and real need, we connect that to the commercial market or universities, where people externally to the hospital help us find solutions to that need. My name is Brian Christensen. I'm Head of Innovation at Bispebjerg Frederiksberg Hospital. And I'm here on behalf of actually many people in the capital region who tries to help clinicians solve the problems they have in the daily work. The need factory at Bispebjerg Frederiksberg Hospital is actually only a few people, because we think that innovation at a hospital should not be in an innovation department, it should be spread out. So we actually only facilitate and gather the need, and ultimately that the need is presented to the market. A good example of a qualified need we have found is the need of mobilization and activation of patients.
As a physiotherapist, our focus is on the patients being as physically active as possible when they're hospitalized. And that is quite the challenge, because when patients are hospitalized, the culture is that they are very much bedridden. My name is Dorita Gunnarsson. I'm a physiotherapist at Bispebjerg Hospital.
There's a lot of solutions out there that tries to mobilize and activate patients who are in a hospital bed or maybe even at home. But the coherence of those systems is very poor actually. You need a coherent system that talks to many different kind of patients who can't even walk and can't get out of the bed. So we would like to make a system together with our physiotherapists, try to do a tender around general mobilization of patients in hospitals.
The interesting thing about the Need Factory is that we have the possibility to express our needs from a clinical reality that is very complex. We as therapists, but also the nurses and the doctors and everyone around the patient thinks it's an important thing for the patient, but we also have other assignments. So how can we get the patients to come out of bed as much as possible, and we all work together to reach that solution.
So when we have the need, we will use a lot of capacity, and that is non-clinical capacity within the region, to try to qualify the need, and actually most importantly try to find if somebody else has already solved that need. Bear in mind, the reason that we do this is to make sure that the clinicians use their time correctly and still work in the clinic, and we try to find out what is the trouble, and then we take that burden off the clinician.
My name is Tommy Henriksen, and I'm from the Danish Life Science Cluster. What I find interesting about the Needs Factory is that it has a need-based approach to innovation. This makes the needs clearer, and when I talk to the companies about which solutions that they should innovate on, we find that the process becomes much easier, more likely to become successful in the end.
When the need has been qualified, and maybe we have identified that we do not have any solutions internally in the region or at other nearby hospitals, then we call our colleagues in the procurement department, because then we need to make a very special tender that we do, a so-called innovation partnership tender, where we do not tender the solution, but we actually tender the need that we have just qualified.
When the hospitals become clear about what they really need in their daily operations, and the needs get validated through interactions with the clinical staff at the hospitals, we get the base for making solutions that are much more likely to become great innovations.
So the reason that we want to tender the need is that we are clinicians at the hospitals. We do not actually always know what could be the solution, but we know the need. So we need to make sure that we find partners who together with us co-create the necessary solution to meet the need.